And I yield to you, sir.
Well, I thank the gentleman for yielding. It's good to be here on the floor with so many of our Republican doctors. When you're at a debate on health care, and you can say doctor, 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 you'd probably better be in a discussion on health care. And I want to say that our Republican doctors have really been doing a great job leading on this issue. Many of them were on the Health Care Solutions Group that I led. You know, we haven't produced an 1,100-page bill or a 1,500-page bill, but there's lots of legislation out there that Republicans are for that would change health care in the right way, and a lot of it that you as individuals are supporting as well. And one thing I've heard, Dr. Brown, all over the summer, throughout the summer and now into these early months of the fall, is why do we have bills that nobody can read, that nobody can understand, and certainly in health care? I suppose if you're on the other side of this issue and you're trying to come up with a health care plan that costs $1 trillion, maybe it all has to work together. You have to have the taxes, you have to have the mandatory insurance for every American. You have to penalize small businesses that don't create insurance for their employees. Maybe it all does have to come together. Certainly in our plan, you can take the bills that we're individually involved in and collectively involved in for medical liability reform. Nothing else has to pass for that medical liability reform bill to save $54 billion. Nothing has to pass for our Association Health Plans bill to be out there and suddenly allow lots of people to have access to health care that they don't have right now. Nothing else that I'm for has to pass for fair tax treatment, so that if you get your insurance on your own, you have the exact same tax treatment that the biggest company in America has if they give insurance to people. So we've got lots of bills out there. There are Republican solutions. The biggest misleading thing said in this debate, which has lots of misleading elements to it, is you can either do what the administration wants to do or you can do nothing. There are lots of choices between what the administration wants to do and nothing. They reform health care without devastating taxpayers. And that's what we're doing. And again, nobody has been better on talking about the doctor-patient relationship and what you do to be sure that doesn't become the bureaucrat-patient relationship than our doctors. And I'm glad to be here on the floor with you and look forward to being part of this discussion.
Mr. Blunt, I want to point out here, we have all these folders here on the desk. Each one contains a Republican bill to help reform the health care financing. Every single one of these. These are all Republican bills that have been introduced in this House of Representatives. Not the one will see the light of day if Nancy Pelosi wants to bury them as she has thus far. Every single one of these is a plan that I think we could get a lot of Democrats if they would ever have the ability to look at them and consider them. But it's unfortunate that this leadership is saying it's either the Obama way or no way. And then they come and literally lie about us not having a bill. Just this morning during special orders, Democrats came and said we don't have a bill. Here they are. American people need to understand that.
If the gentleman
yes,
we have plenty of alternatives, and I am absolutely confident that if you ask the American people, would you rather have one 1,500-page bill? I actually heard today that the Senate bill, the Baucus bill, is over 1,500 pages. Would you rather have one 1,500-page bill, or would you rather have 15 bills that were all less than 100 pages that you could debate one at a time, that you could change the system in a way that people understand exactly what you're doing, and that you don't devastate future generations with a health care plan that just simply can't be paid for, when we have reforms that would create a lower cost of health care generally, lower cost of taxpayer-provided health care specifically, and not add to the federal deficit. And I know I know the answer to that. Doctors, I know the answer to that, and you do too. You were all with the town hall meetings. You've been on telephone town halls, and people are tired of bills where the answer, where the problem is hidden somewhere in the bill and nobody can find it. And believe me, if there's a 1,500-page bill, if this Congress stays true to form, there'll be a 1,500-page substitute put on the table the day we're asked to vote on it, and nobody will have possibly had time to read it. And the bills right behind you are not only the Republican solutions to this problem, but they're also the way the American people would like to see this problem solved, and we're working hard to do that. We'd just like to have an opportunity to present these bills. We'd like to have an opportunity to have a hearing on these bills. We'd love to have an opportunity for these bills to be debated on the House floor. So far, nobody's given us that opportunity at any level, and I yield back.
Thank you, Mr. Blunt. I appreciate it. I appreciate your chairing the